Hi, my name's Maya Koblanski. I'm a third-year medical student here at UBC Vancouver. The first one was creating an introductory data science and AI module for medical students. Overall, we worked together, we built a storyboard, and we reviewed the current literature and found two key topics were one, for medical students, future doctors, to be able to understand fundamental data science and AI concepts. For instance, what are models and just the general pipeline that goes behind building different programs. But importantly, in the literature, we saw that it's important for future clinicians to actually be able to critically appraise different tools, because this is the role that we're more likely to play in healthcare. There's a development process, and then there's the application process. And it's really important that we can critically assess tools, because these tools in the end will help us provide patient-centered care.
Hi, my name is Andy, and I'm currently a third-year medical student. Previously, before I started medicine, I did a degree in physiology and then subsequently computer science as well. We thought that hosting a datathon may be a good first step for interdisciplinary collaboration between data science, computer science, and medicine, and a good way for people to get a taste of what it's like to combine the fields together. Some of the projects that came out of the competition were quite astonishing. For example, one team created utility for clinicians to be able to use clinically to predict stroke risk, something that they said that can be incorporated directly into the EMR workflow. Other projects include using the chest X-ray to predict when radiologists can identify certain pathologies such as pneumothorax, pneumonia, and they think that these tools will be able to aid in the diagnostic workflow and accuracy. And I was quite happy to see what different people came up with.
So my name is Dheyaa Al-Najafi. I'm a third-year medical student at UBC Faculty of Medicine. I already have a Bachelor and Master's of Biomedical Sciences from University of Guelph as well. As we're thinking about how to use large language models like ChatGPT and other models in assisting in making MCQ full questions for medical educations. So for example, in our class, we have around 300 medical students, and we were doing mock exams using AI versus normal human-made exams, and to assess, the differences in terms of student perceptions, in terms of questions difficulty, the questions quality, validity, and how the questions were helpful for the students to prepare for the real exam.